Hello, I'm Dr. Liming, consultant ophthalmologist and glaucoma specialist from Park City Medical Center. Today, I bring you through two types of glaucoma, that is primary open-angle glaucoma and primary angle closure glaucoma. This diagram clearly illustrates the classical presentations of glaucoma. The high pressure in the glaucoma eye will compress on the optic nerve. As the disease progresses, the optic nerve will become thinner and thinner. And this affects the patient's visual field from peripheral first. Then the visual field defect will slowly extend to the center part. And at the end stage, when the visual field defect extends to the front center part of the eye, then the patients will experience blurring of visions. That's why glaucoma is called silent thief of sight. To understand glaucoma, we have to understand there are two types of fluids in the patient. One in the outer surface is called tears. When we cry, the tears flows. When we have not enough tears, we simply have dry eyes. In the inside of the eyeball here, there's another type of fluid called aqueous. The function of the aqueous is to bring oxygen and nutrient to the eye. The aqueous is being produced by the ciliary body here, and the fluid will circulate and go to the anterior chamber of the eye and go to the angle of the eye. In the angle of the eye, there is a structure called trabecular meshwork. This sponge-like will absorb all the fluid and transmit to the blood circulation. In a healthy eye, the aqueous secretion and the outflow is balanced, give us a normal pressure of 10 to 21 mm mercury. In open-angle glaucoma, although the angle is wide open, but the resistance to the flow build up over the times. That's why the pressure build up in the eyes. There are two types of open-angle glaucoma. One is primary open-angle glaucoma. The other type is secondary open-angle glaucoma. Secondary means there is something causing blockage to the open angle. For example, patient has history of trauma, the injury has injured the drainage eye, or patient has severe diabetic disease, or patient has stroke in the eye. The new vessel will block the angle and cause secondary open-angle glaucoma. But the other type of open-angle glaucoma called primary open-angle glaucoma is more important. 80% of the glaucoma come from this group. There is no obvious cause. The resistance simply build out in the chamber, in the angle over time. We can only talk about risk factor. There are many risk factors for primary open-angle glaucoma. For example, advancing age, more than 40 years old. Patients have family history of glaucoma, have at least 4 to 10 times more risk of getting glaucoma compared to normal populations. Those with high myopia and those with cardiovascular diseases like hypertension or diabetes are more prone to have primary open-angle glaucoma. Type of glaucoma, angle closure glaucoma. This is a very important type. Although it contributes to about 20% of all cases of glaucoma, it is responsible for 80% of glaucoma blindness. As you can see, the angle here is very narrow. There are very little space between the iris and the cornea for the fluid to flow out. Sudden obstruction to the fluid flow or the aqueous flow can happen, and this leads to sudden rise of eye pressure. The eye pressure can go up so high as 50 mm mercury. That results in severe eye pain, red eye, and patient could have sudden loss of vision. Patient can be so unwell with nausea and vomiting, and the headache can be so severe like migraine. Angle closure glaucoma is an ocular emergency that requires immediate medical attention to prevent permanent visual loss. The risk factor for primary angle closure glaucoma, age more than 40 years old, family history with glaucoma, those with small eye or sightedness, Certain races like Chinese have small eye and they are particularly prone to angle closure glaucoma. The secondary cause of angle closure glaucoma are hypermature cataract, tumor behind the eye, severe eye inflammations, or dislocated lens secondary to trauma. Glaucoma can only be detected through early eye examination and screening by an eye doctor using this eye instrument. I'd like to bring you to an interview platform to meet three of my glaucoma patients. They are Mr. Steedman, Mr. Kenny Yee, and Mr. Roy Chan. They have kindly come forward to share their experience as glaucoma patients, and they are also my ambassador to create glaucoma awareness. Thank you.
Hello everyone, I'm Bob Steedman. I'm one of Dr. Lee's glaucoma patients, and I'm also the Deputy Chair of Glaucoma Support Group. As a patient, I was diagnosed with glaucoma in 2012 and was referred to Dr. Lee in 2015 when I had 2 cataract operations, and then in 2016 I had a trabeculectomy of my right eye. And here we are 5 years later, all in good order, and very happy with all of that experience, although it had its ups and downs along the way. Today I'm going to talk to you briefly about the Glaucoma Support Group, and then I'm going to interview 2 of Dr. Lee's patients. The first one will be concerned with open-angle glaucoma. Our support group was put together, initiated by Dr. Lee in July 2016, and we have a number of meetings each year, or at least we did before COVID intervened, and we also have, for the benefit of all of the members, the WhatsApp chat group. The meetings are held in the Park City Medical Centre here, and a room is provided by the centre together with refreshments for members. It's a greatly appreciated facility. The meetings that we hold are informal but structured, so that, for example, new members can describe their experiences so far, their concerns, their issues, and then the existing members can talk to them about their own experiences related directly to the new members' issues. Other issues will arise as time passes, and many of those can be bundled up by the chair of the group and put to Dr. Lee in bundles so that she has to respond only once instead of lots of times to different patients for the same issues. The questions which arise are very variable, but Dr. Lee helps the group at each meeting by coming in and bringing members up to date with new advances in glaucoma treatment or diagnosis from around the world. And also she organises educational style talks from specialists of various kinds, for example, on how to breathe better to avoid anxiety, how to deal with the drops which people have to take as part of their medical treatment. The chat group has many of the same issues, but may be used more informally as well to give members a sense of community so that they feel that they're not alone. And this is important for, I think, all of our glaucoma sufferers, that you don't feel alone, and that although the issues arising from diagnosis and from treatment may have many rather negative and depressing effects, the realization that you're in the group talking to people who've already been down that route, had that experience, had that procedure, and yet come out of it still smiling and still in good order, is a huge benefit for everyone. And in a sense, the essence of what the group does, it can be summarized as saying that it's a question of patients caring for patients. We all, I think, benefit from that, and all of us individually from group meetings, of course, carry the experience all of the patients at those group meetings with us to our own individual benefit and to the collective benefit of the patients overall. And I suppose the old saying that a problem shared is a problem solved is the essence of what we do. That's all I want to say about the group today, but I'd now like to introduce you to one of Dr. Lee's patients who's going to talk to us about his experiences of open-angle glaucoma. He and his wife have been greatly supportive of the support group, but today he's going to share his experiences with all of us. Hello everyone. I'd like to introduce you now to another of Dr. Lee's patients, Mr. Kenny Lee, who's going to talk to us about his experiences on open-angle glaucoma. Kenny, take us through how it all started.
Well, it all started about 5 years ago. Because of the insurance policy, I went for a medical checkup, and the GP doctor actually advised me to seek an ophthalmologist to get further tests done. So at the time, I have no symptom. There's no family history, and I have no problems doing 120, 140 kilometers along the north-south highway or NKVE. And so I was at least problem about getting the checkup until when the ophthalmologist actually says that I have glaucoma. So obviously the first question that comes to my mind, I ask him, I say, come on, don't frighten me with all those big words. I do not know what is glaucoma. And obviously the word glaucoma doesn't sound good to me. And as you all know, there's always a saying, and it says that, well, the beauty of the word rests on its meaning, not its sound. So I went on, I Googled for its content, and I can assure you it was not beautiful at all either. So that's how I started knowing glaucoma.
So just to recap on that, you had no thought beforehand until the doctor told you you had glaucoma, because in fact there was anything wrong with your eyes.
Yes, there was no symptoms, no family history, and I have no problem, as I say, doing 140 kilometers per hour along the highway.
But even now, looking back at that point in your life, were there any clues at all that you missed before the diagnosis took place?
Well, very hard to say, because basically whatever you don't see, you will not know.
Yes.
Yeah, so that is actually the main problem. Because glaucoma is actually a silent disease. If you don't see it, you don't realize it. That is the main thing. I suppose that is the whole campaign about, is the awareness of the disease.
So you moved from being the man in the street to the man in the street with glaucoma.
Yes.
And what was your response at that point? There was the doctor giving you this bad news. What did you then do?
Okay, the response. Well, obviously, my first response was to start reading about glaucoma. And, well, as we always say, and it's quite true, as we start to read more and more, especially in my case, when I started to read more and more, understand it, I actually found that my blood pressure went higher and higher. So that was actually not very encouraging. So whether you say that I'm gassy or gassy is not the slight. I seek professional medical help almost immediately, as soon as possible. And I can still remember then, there was one occasion that someone actually said to me, and he was telling me, he said, oh, don't worry, Kenny, the operation will be carried out on one eye at a time. And you have two eyes. So if the operation failed, you still have the other one. So honestly, it doesn't go well with me.
It's not very encouraging.
Not very encouraging at all. So we went back. we start shopping for doctors. And praise the Lord, we found Dr. Lim Yen Yap. And obviously, our first meeting itself gave me a lot of confidence. He draw the card on me, and we went through, and she put me on a series of tests actually, and she confirmed that I actually have the primary close open angle glaucoma, and in fact, it's in an advanced stage. And the result, we can share with you the result of the field visual test. So this was the result then, and what you can see is that all those black area are the part of the vision field that I couldn't see at all. So it doesn't look interesting. It doesn't look good at all.
Is that the right eye or the left eye?
This is the right eye, and this is the left eye. So it's not encouraging at all. And that is the time when I realized that whatever things, or whatever you think the thing is real or not, it's not until when you experience it yourself. And that piece of bad news actually struck me very hard. And I can assure you, bad news is not wine. It doesn't improve with time. So that really has taken a lot of me. Yeah.
So then Dr. Lee confirmed the bad news. What happened at home or at work? Were you still going to work at that point?
Well, the good thing, or rather the fortunate thing, is that I'm a retiree, so I don't have to work. But then, even then, the knowledge of having this disease, this glaucoma, is also not very easy to handle with. It's definitely not a walk in the park for sure. So it was really a full cycle of, I would say, fear and anxiety before the treatment, and anxiety and hope after the treatment. So it was not easy at all.
Tell us about the treatment that you started with. You had the diagnosis.
Yes.
What was the next step?
Well, the treatment itself is not as bad as I thought. It was more on the mental issue.
Right.
Yeah, it's much more on that. And I would say that the support from family members actually comes in.
And in terms of the family being involved,
Yeah.
since you were not a glaucoma patient as
Yeah.
it were before, there was no family history of it.
Yes.
How did you assist the family in assisting you? How did they get to understand what glaucoma was all about?
They don't understand actually, because as I said, there was no family history.
Yes.
I'm the first one. So it's just like you are turning the bigger wheel, and so happened that the arrows point at me, and so we have to go through a lot together as a family. And obviously, having a good doctor that shows empathy helps a lot, and that actually, I would say, helps me to recover. But then the worst moment, if I may share with you how I feel about it, the worst moment actually comes in during the early days before treatment, and that is when I was totally controlled by fear. And I can say that, a good day can suddenly become a bad day almost instantaneously when the fear kicks in. So just sometimes just the mere thoughts of eye surgery, blindness, will immediately lead my attention to things that, I might fear. Yeah? So that was the difficult part to get over with. But obviously, the most assuring part is that when I joined the glaucoma support group, there I found members who are so willing to share their experience. They give advice, they give opinions. And that is great because I'm actually listening. I'm hearing it from the horse's mouth. And that, I believe, they are true and they are real. Yeah. They sort of give me the foretaste of the good, the bad, and what is to come. And I must say that that is the most assuring thing that I can get from this group. And on top of that, I get the whole picture just from listening to those who are waiting to go under the knife, and also listening to those who have recovered successfully from treatment. So it gives me the whole spectrum, and I really think that these are the unsung heroes, and I benefited a lot from it. And if you are a soccer fan, I'm not sure whether you are one, and if you are one, and especially if you are a Liverpool supporter, their song, "I Will Never Walk Alone," came through just like Switzerland. And that was indeed very good.
And then, so coming back to the family issue, you attended the group, you heard firsthand what other people have been through, and so there was the beginning of hope in your mind that maybe you would go down a better route than the route you thought you would go down. Mm-hmm. But how did you involve the family in helping you help yourself at that point?
Well, I think if I may talk a bit more about fear, then that really will bring the involvement of my family into the picture. So, just sometimes just the mere thoughts of eye surgery, blindness, will immediately lead my attention to things that, I might fear. Yeah? So that was the difficult part to get over with. But obviously, the most assuring part is that when I joined the glaucoma support group, there I found members who are so willing to share their experience. They give advice, they give opinions. And that is great because I'm actually listening. Probably another point that's worth looking at is do not despair. Stay positive. As they say, don't despair. For every storm loses rain. Just as every dark night turns into day. So stay positive. But staying positive doesn't mean that everything will turn out okay. It's just that rather than you know that the knowing that you will be okay no matter how things turn out. So that is the point that I can bring across, and I suppose that is about all I can think of at this moment.
Well, I think that brings us very nicely to the end of the interview. Thank you very much
Well,
for sharing with us.
Thank you, Bob, and I want to take this opportunity to thank my Lord for His grace and mercy. I'd like to thank my wife and my children for their immeasurable support. I'd like to thank Dr. Lee for her empathy and for the successful treatment. And I must say that the holistic approach of including the glaucoma support group into the patients is most admirable, and I really thank her for that. And I want to also thank our members of our glaucoma support group for their unreserved, unselfish sharing. They are really the unsung heroes. And I really pray for their eye condition. And last but not least, I pray for the nation. And I pray for the end of this pandemic soon. And I'd like to say thank you and God bless.
Thank you very much. Hi everyone. The second interview today is with another of Dr. Lee's patients, Mr. Ram Chan, who's going to talk to us about his experiences of his form of glaucoma, which is the primary angle closure glaucoma. Ram, welcome.
Yeah. Hello, I'm Ron Chan, and this is what primary angle closure glaucoma is like. The effect, you get tunnel vision. You know, this is on my right eye. This is my left good eye. It's very clear. I can see. The field of vision is wide. Here, the field of vision is narrow. But I'm not complaining. I'm very happy that it was that way. Why? Because I did not go blind. I still could see all of you. Yeah. And that gave me 3-dimensional vision. If I were to have no sight in this right eye, I would have to walk very carefully. I won't be able to judge distances. And when I drive, I will be driving dangerously. Right?
So,
Okay.
well, let's go back to the beginning.
Okay, let's start
And
from the beginning.
yes, how were you originally diagnosed? What happened?
Okay, 3 years ago, one night, I experienced acute pain in my right eye. Frightening, acute pain, not just simple pain. So deep set pain. I couldn't sleep, but eventually I slept very lightly until the next morning. And surprisingly, for a few hours, my eye could not see anything. Blind. Yeah. Then later in the day, the sight came back, and I rushed myself to see a doctor. And the doctor said, Mr. Chan, you had acute angular closure glaucoma. Something very serious to him, and also serious to me. So he quickly wrote an introductory letter for me to pass to Dr. Lee Yue. Go and see her immediately. So without much ado, immediately I went to see Dr. Lee. And Dr. Lee did some tests on my eye, and indeed it was acute closure glaucoma. And she did some procedures or did some eye drop to stabilize the pressure. The pressure was very high, maybe 50 to 60 psi. So with that, soon after that, I think a couple of days later, she did some sort of a semi-emergency operation to remove the lens. Together, the lens of the cataract, plus its bed, which was pressing on my eye to release the pressure. And immediately, the eye pressure stabilized. The vertic IOP, intraocular pressure of the eye stabilized. 1 month later, she did another surgery. To implant. Before the doctor implanted the claw lens on the way, as the precaution to prevent the other eye, the left eye, from developing glaucoma, she did a semi-emergency operation to conduct what you call it the peripheral iridotomy action procedure of that, to puncture with the eye with lasers to release the pressure from the aqueous fluid. And so that was a very good decision. If that were to get blind, and I also have this right eye blind, then I'll be totally blind. So that was a procedure which was very wise of the doctor to do it. I really am grateful. And that was 3 years ago, and then until last year she did a cataract operation to further prevent glaucoma from attacking this left eye, right? So right now I can see very clearly with a very good 100% vision here, and with a somewhat reduced vision, but still very, very usable. And I can even drive at night without fear. A message to the audience, whoever is watching this show, that whenever you sense something wrong with your eyesight, for example, when you are out in the sunlight and you feel very uncomfortable with your eyes, or when you are driving, you tend to swerve to one side. As what my wife always complained, so she's there watching. Go and see a doctor immediately. More importantly is to see an eye specialist, because the eye specialist will have the equipment to detect any abnormality in your eye and take corrective measures immediately. Right? A doctor will only dispense some eye drop for you and ask you to go home. So see a specialist. And, I think that's all I have to say.
That sounds like pretty good advice to me. Thank you very much, Rob.
Okay, before I finish and go off, I have got 3 spectacles to show you. 3 glasses. Now, this is unique, very unique. And even got a special shirt with 4 pockets to show. There is a reason for doing that. This product is in the daytime if I walk about. It is to protect insects and dust from attacking my eye. Right? That will cause infection. Correct? Yeah, sometimes you can see a fly or a small insect flying in the eye. Then what are you going to do? The Dr. D is not around to take away the eye. Next one is not so bright sunlight. I have a lighter pair of sunglasses, right? So that I won't feel the impact of the light onto my eyes. And if it's bright light, for the last few days when the weather was very hot and the sun was very bright, I even have a darker set of glasses, right? With a visor glued onto it, you have double protection. Just one eyeglass itself gives you 70% light entry. If you have a 2, it's 7.7 times 0.7 is about 50%, 49% blockage of the light. So it will be effective in blocking the bright sunlight. Okay, and also protect from dust and insects. Hopefully, with all these precautions and with Dr. Lee's treatment, I can, within my lifetime, protect my eyesight. Thank you, Dr. Lee.
Thank you.
Thank you very much.
Right.
For another 20 years.
Yeah.
Hello, everyone. I'm Dr. Lee Min. Thank you for tuning in. Good evening to all of you. And thank you to the Malaysian Glaucoma Society and the technical team behind to make this happen. That was a pre-recorded video. Thanks to my patients who have kindly come forward to share their experience, Mr. Stedman and Mr. Penny Yee. Tonight we are having 2 of them. Mr. Ron Chan, and Mr. Kenny Yee is with us tonight. Just now, I think the video there is some technical problems, and Ron Chan's conversations was not out, so we have the chance to interview Ron Chan now. Uncle Chan, Dr. Lee here. Okay, Mr. Chan, can we
Yeah.
talk about
what-
crucial glaucoma? Mr. Chan, can we talk about angle closure
shall I start now?
glaucoma? So Mr. Chan has acute angle closure attack and he was referred to me. So can you tell us your experience, your first experience when you first have eye problem? Like you talked in the interview.
Okay. Good evening, everybody. My name is Ron Chan, and I'm 76 years old. 3 years ago, I felt a sharp pain in my right eye, and at night, and I was sleeping. Then I woke up, but and then the pain went off, and I continued to sleep, but very restlessly. The next morning, when I woke up, it came back surprisingly, but I was a bit worried what happened to me. So I rushed to see a doctor. The doctor inspected my eye and said, "Mr. Chan, you have a glaucoma attack. Don't delay anymore. I will write you a note to go and see Dr. Lee Ming without delay." So on that very same morning, I rushed to see Dr. Lee in the Desa clinic, in the medical in Desa. And she confirmed it was primary angle closure glaucoma. She gave me some eye drops to stabilize it. And at the same time, she arranged for peripheral iridotomy procedure on my left eye to prevent an attack of glaucoma on this eye. If that happened, I would have both eyes attacked by glaucoma and would be very dangerous. I may lose the sight of both eyes.
So Ron, you were experiencing blurring of vision for a few hours, right? Before we managed to bring down your pressure.
Yes.
Can you tell people about that experience?
Didn't catch you, doctor. Your voice was breaking up.
So you were having blurring of vision for a few hours, right? When your doctor told you your pressure went up to 50 millimeter mercury, so you were having few hours of blurring of vision. So how was that experience? Was it terrifying?
Yeah, it was quite frightening because at that time when my eye went blurry, I could only see with one eye, right? And of course, judging distances would be very difficult. I had to walk very carefully during that period, but eventually I got adjusted to it. And after all those eye drops and so on, the next procedure was a month later. Doctor did what we call a procedure where put in the iris claws, you know.
Yeah.
And after putting in the iris claws,
Mr. Chan came in with angle closure attack, and we find that your cataract already subluxated. That means your lens already dropped. So the high pressure makes your lens already drop. It's the same. It happened at the same time. That's why we remove the lens first, then stabilize the pressure. Then we put in a iris claw lens. Yes. Then after
Correct.
that,
First, she has to remove the cataract and the bag to stabilize my pressure in my right eye. And yes, and for a month, I was actually a one-eye jack, more or less, could only move around. So it was a difficult moment for me. I could not drive normally, maybe for short distances. And most of the time I had to rely on my wife to ferry me around, you know. So after that episode, 1 month later, the doctor inserted the iris claw onto my right eye, and I could see. It was a very elated day on that day. So happy, right? I thought doctor, salute her for carry out a very delicate operation. She told me she only had 3 mm space to work on. That's wonderful. She must have very deft hands, So when she implanted that iris claw, until now, later, I have good eyesight. I can drive around, even at night. I can drive. So that is a blessing. A blessing.
so
Yeah.
you
Any more
last year
questions you wish
you
to ask me, doctor?
yeah, last year you
Oh, yes.
underwent another surgery that is in your good eye. So can you tell
Yeah.
us
In
about
my
it?
good eye, I thought, yes, I thought my eye was good, my left eye. But doctor was very anxious. Doctor knew that I was in harm's way, and I didn't realize it, and was very stubborn. I didn't want that to be removed. He reminded me again and again. And eventually I saw light, not brightness light. The light means the meaning why she was trying so hard. She did the peripheral iridotomy, was an immediate semi-emergency measure to not to release the pressure in the eye. Then comes the next step. The next step is the removal of the cataract so that she can implant a new set lens there, which is thinner, which does not press onto my eye and cause another glaucoma attack. So that was the one that I did not realize what she meant by insisting that I have to do. Now I know, doctor knows better. I'm only a layman. I was so stubborn. Thank you, doctor, for insisting that I remove
Okay,
the eye.
welcome.
And now I can see it very
Okay.
clearly, right? And no worry about another attack on that left eye. Yeah.
Okay, thank you for that.
Yes.
Okay, we go a little bit on management of primary open-angle glaucoma with Kenny Yee. As we all know, the first
Okay.
line of treatment of primary open-angle glaucoma and most of the glaucoma is like medications by putting eye drop. It is very efficient and it's very easy to do it and it's very safe. So Kenny, you said that you were diagnosed primary open-angle glaucoma in year 2015. So I'm quite sure at that point you were started with many eye drops. Um, how can you tell me how did you do with the eye drop? How did you cope? Any side effects? How do you keep yourself adhere to it?
Right. Good evening, everyone, and evening, Dr. Lee. Coming to the eye drops,
Yes.
I
Yeah. Doctor
yeah. Okay.
prescribed dry drop that I drop twice a day.
Okay, Ron, you can
Until
say first.
now, it's already more than a year.
Yeah.
Sorry,
So Ron,
voice
you are
breaking
now
up. I don't
on
know what
a
happened.
yeah. So Ron, your condition has been stabilized. The right eye, although the cup-teeth ratio is 0.9 with tunnel vision, you are stabilized with one eye drop. Your pressure is around 10 to 30 millimeter mercury, stabilized. I have warned you, if your condition worsen, I may need to do a glaucoma surgery, but so far so good. But your left eye is a completely good eye with cup-teeth ratio 0.3. Okay. Now we ask Mr. Yi, how did you cope with the medication at the beginning? Mr.
Right.
Yi, Kenny Yi?
Yeah,
Yeah.
thanks. Well, to start off with, I was already in the advanced stage, and that means that I was already beginning with 3 different types of eye drops or medicine, and not long after that, it was already to the maximum of 4 different types. And I would say that I have quite a tight schedule, in a sense that almost every day you'll be doing, four drops or even sometimes more. And the only way to remain or to keep within the schedule is to put alarms in my handphone. So every now and then you have a alarm that went off, and that reminds me to do the eye drops. And so it has been going on for more than a year. And of course, everybody start to look at me and they say, "Wow, Kenny, you have nice long eyelashes." They say, "We envy you." I say, "No, this is because of the eye drops. It's the side effect. And I believe some patients have red eyes and so on, but I have no red eyes. It's just that the eyelash keep growing, growing. And it's to the extent that sometimes it doesn't look real anymore. So that's how I've been doing the eye drops, and that actually went on for more than a year. But during the period, obviously, I have regular checkup, and after that, it seems that the pressure was not going down any further, and in fact, it started to climb up a little bit. Yeah.
Okay, when Mr. Yi saw me, his pressure was still controlled with medications, but looking at his cup-teeth ratio of 0.9 with very advanced visual field, he showed just now. So I anticipate he will probably lose his vision during his lifetime. So at one point, we told Mr. Yi, we do your cataract surgery first. It's a stage procedure. After that, we will have to go for glaucoma surgery, glaucoma filtering surgery. That is trabeculectomy. So I gave Mr. Yi few months to think about it when the pressure still can control. So in a very conservative society, a lot of patients, when you mention surgery, straight away they will run away. Okay, what was your reaction at that point? How were you? Did you really trust our surgery? Did you really believe that surgery will help you? Can you share your experience?
Well, at the time, it was like I was hoping the eye drop can do the job, and obviously it failed because the pressure came up. And when you told me about putting me under the knife, obviously the fear kicks in. And the psychological part is something that no one will really understand until you really experience it. So the fear was really something real. And it reached to the point where, of course, Dr. Lee yourself was telling me, Kenny, you have to make the decision. You have a lot more to lose if you do not do it. And well, I'm just a poor engineer. Of course, I had to listen to the qualified doctors. I don't think I have any other options. And of course, you assure me that I'm in good hands, and you explain to me all the procedure, the probable outcomes, and you share with me some of the medical terminology, which sometimes I must admit I don't really understand.
And I think the other thing that helped you a lot is the glaucoma support group. You meet the patient who has undergone the surgery, and you see Mr. Neo can still see very well without any medication. So
Yes.
now you have successfully gone through the two surgery. I think one eye was 2 years ago, one eye 1 year ago, and now you're medication free with 10 millimeter mercury of pressure. You are no need to put any eye drops. So how's your feeling now? Would you at this stage encourage others to do surgery when they needed to?
Yes, a big yes. I mean, having gone through the whole procedure and having experienced it, I think the main thing is to overcome fear, and the group members, the chat group, is wonderful. And of course, the main thing is the trust in the doctor.
Okay. So for the public, now with the advance in medical technology and surgical techniques, when we have move field safe surgery technique, where I was taught when I was I did my attachment in London. So now the number of glaucoma blindness has become 50% less in the past 20 years. So I think the public should not fear of surgery because it's successful, it can prevent permanent visual loss. You know, glaucoma is a really silent thief of sight. You can lose 10%, 20%, up to 90%, like Mr. Yi, up to 90%, the visual field constrict like that, but you still can see through the keyhole. Mr. Yi, you still can see your wife, right? So,
Yes.
but Mr. Yi, from last time he could drove 160 kilometers per hour. Now she stopped driving, so she really realized that is cut this ratio 0.9. We have a lot of patients 0.7, 0.6. They don't realize it's very difficult to convince them. Now, with the current, about the past few years, the new surgical technology has come out. We call it minimal invasive glaucoma surgery, and I have already started putting in my patients. I know Mr. Yi, one of our friends, already got the eye stent in the eye. So I want to ask you this question: if 5 years back the technology has come and your doctor say, Mr. Yi, you put in this eye stent, your pressure can lower and you help to flatten the curve, would you put it at that point?
Oh,
2015, when your vision was probably still better.
wow. Definitely, I will do it.
Definitely.
It's with an unsound mind that I will not do it. Definitely, I will say yes.
Okay, thank you very much. I would like to let Mr. Yi, do you have some advice to tell our audience? And Mr. Chan also, I let Mr. Yi speak first. What advice you would like to tell the audience?
Yes. Okay. First of all, allow me to applaud the Malaysian Glaucoma Society for running this series of presentation and interviews in conjunction, of course, with the World Glaucoma Week. And I really believe that the information that the society is sharing today is going to save someone's eyesight tomorrow. And this, I really believe so. And what I would like, if I could, do I have about a couple of minutes, Dr. Lee? Should I just?
Yes.
Yeah, I have. Because I have gone through the whole process, and I do not want my experience to go to waste. At least if it can help someone out there, I think it serves its purpose. So I would like to draw a few meaningful suggestions as I go through the various stages. To begin with, stage 1, that is before anything happens, go for regular checkup, especially for potential glaucoma patients, because for them, everything seems right on the surface until a checkup will tell us our inside story. So don't leave it undetected, because it is not how far you can see, it's really how long can you still keep your ability to
Very
see.
correct.
Yeah, so that is the first thing. The second stage, when you have already, confirmed that you have glaucoma, seek specialist treatment as soon as possible, because time is of essence. Because whatever damage is irreversible, and it's always with deep regret. And this is something that I felt, I feel very deep inside me. If I could have detected it earlier, if I'd known this disease, it would have saved a lot of my vision field. And the third stage, following the treatment that the doctor gave, I must say that by all means follow the doctor's prescription. Yeah? And I say that means that don't ever change the description for your own convenience, let's say. For example, don't skip eye drops just because you're busy on the computer. Or don't do any eye drops on a Sunday because it's a rest day. Never do that. Follow strictly to the doctor's prescription. And honestly, if you have problems following a doctor's instruction, then most likely you don't already understand the seriousness of this disease. And you do not know what it can really do to you. Until and unless you really know that the disease can bring you blindness, then you'll follow every single detail, A to Z, what the doctor will say. And this is really from my experience. Then you come to stage 4, when you are told to go for surgical procedure. That is when your eye drops treatment is not sufficient and you go for the procedure, and obviously that leads us to fear. And that is what I have felt earlier on. And it's quite common to many patients out there. And fear, basically, F-E-A-R, has two meanings. Either one, forget everything and run away. F-E-A-R, forget everything and run. And you know very well where you will end up. Or face everything and rise, F-E-A-R. Okay? And you have the second option, and with that, you must need the support of your family. Let's do it together with the family. And thinking alone will not overcome your fear. You have to act. So, like in my case, I listen to Dr. Lee. Dr. Lee say I'm in good hand, so I go for it, and no regrets. Okay. So.
Okay. Thank you, Mr. Yi. And Mr. Chan, do you have anything to say? Mr. Chan, do you have anything advice to say to the audience?
Well, I do all my children.
I have an advice for Mr. Chan. You know, Mr. Ron Chan? Yeah. You want to say something? Mr. Ron Chan has faithfully go to one of the hospital to take care of his heart, and he has 4 stents in your heart, right? But you go to hospital, despite go hospital so many times, nobody asks you to check the eye, correct?
Yeah, correct.
So I will say, I will advise the public to do your eye check as soon as when you touch 40, 50 years old, or you have family history, you have to go much earlier. All right. Now we go to question and answer.
That's why I go.
Yes? Yeah. Okay, thank you to Mr. Kenny Yi and Ron Chan. Let's go to the question and answer session. Okay, my first question is, can cataract surgery prevent glaucoma? The answer is yes and no. Okay, for primary open-angle glaucoma, we talk about risk factor. Risk factor of age, family history, myopia, your cardiovascular disease. Even you do cataract surgery, your risk is still there. Although studies show, but doing cataract surgery can lower your pressure 1 to 2 millimeter or up to 4 millimeter, but the result is not consistent. Yeah. But for angle closure glaucoma, yes, it's definitely helped when the lens has become increase in size, that means that the cataract is bulging forward and compressed at the angle, on your angle, then it's beneficial. So when patient come to me with a cataract at the age of like 50 to 55, if I look at the angle is a bit narrow or very narrow, and the cataract is significant already, it's definitely very beneficial to take out the cataract. You are killing two birds with one stone. That means you get rid of the lens opacity, and at the same time, you reduce your risk of getting angle closure glaucoma, or you reduce your pressure as well. Okay, the second question is, does blood pressure affect glaucoma? Something like that, yeah. Yes, if you have high blood pressure, you can get glaucoma indirectly. If your blood pressure is too high, you are at risk of getting stroke. If you get stroke in the brain, you have hemiparesis. You can't move your upper limb, you cannot move your lower limb. But at the same time, you can have stroke in your eye. The artery or the vein can get blocked, and you experience sudden loss of vision, and later it can give rise to complications like secondary open angle glaucoma. Then it can progress to angle closure as well. If your pressure is too low, like over-treated hypertension, patient take medication at night, especially if your doctor is over jealous, want to bring your pressure too low, and you take medications at night, when you sleep, the blood pressure go even further, then this will lead to hypoperfusion of your eyeball. That means not enough blood supply to your eyeball. That can impair the blood flow, impair the delivery of nutrient and oxygen to your eyeball. That can indirectly causing the optic nerve damage. We do see patients with blood pressure, eye pressure of very well maintained, maybe like 12 to 14. There's no reason of further compression of the optic nerve, but visual field keep progressing. At this point, you have to review all the medications. Your patients on blood pressure treatment is over-treated or what, then we will monitor by doing 24 hours blood pressure monitoring. Is it too low? If it's too low, we will write to their physician to adjust the hypertension medications again. Yeah, I hope this answers your question. Okay, the third question is, does diet affect, or what diet can prevent glaucoma, or yeah, something like that? Can glaucoma, what diet is beneficial or prevent glaucoma? We can't really quote you any study, but what we know is antioxidant is good, yeah, and some diet or that can increase the blood circulation, like ginkgo biloba. Yeah, ginkgo biloba is often prescribed to the patients with very bad optic nerve damage, like already blind or seeing counting finger. The pressure is well controlled, and the doctor will say, why not they take some supplement, ginkgo biloba, to increase your blood circulation so that your little vision left can still be preserved. At least you get some navigation vision. Exercise, aerobic exercise is good. Aerobic exercise mean running, yeah, swimming. But some exercise like head down position yoga is not good, because when you put your head down, your eye pressure increase. One study has shown that if you put the eye upside down, the pressure can go up to 30 millimeter, up to 40 millimeters within 2-3 minutes. So I don't encourage head down position in yoga too long. I think you probably can do 1 minute. And the other thing, we talk about instrument. If you have glaucoma, some music instrument like trumpet or wind instrument where you need to blow, when you blow, the Vasava maneuver is high, yeah, your pressure, your body pressure is high, your eye pressure can go up as well. It's not very good. And for men, if a glaucoma patient, you're wearing a tie, too tight a tie, is also not good for your eye pressure. I think I have answered all the query. So can we end the show? Lastly, I would like to, I hope that you can help us understand you better by taking 1 minute to answer a simple survey form. Please scan the QR code here and go to the survey form. Thank you very much for tuning in. Thank you and good night.